This may be one of the most important 15 minutes for you and your loved one's most important assets, your health. This is the best $9.99 a month for yourself or $29.99 a month for your household, 3+ you'll ever spend. You deserve Compassion MD. Let me tell you why. From fear to clarity with direct care. You know, one of the worst things in life is not feeling well, or being told you have a diagnosis, a condition, or a treatment plan you don't fully understand. For you, for your loved ones, or not to mention for your child. That moment can stop your whole world. You're already dealing with the fear, the symptoms, the stress, and then you're forced into a healthcare system that's complicated, confusing, costly, and uncertain. And what do most people do? They wait, they guess, they Google, they hope they're making the right decision. They hope it doesn't get worse. But what if this entire experience of 6 days, scary diagnosis, confusing treatment plans could be transformed for less than 50 cents a day? What if your healthcare journey could feel cleaner, calmer, and more certain because you had direct care, a doctor who works directly for you? No middleman, no long waits, no surprise bills, no confusion, no feeling lost or alone, just compassionate medical guidance and world-class care anytime, anywhere. And here's the powerful part. Direct care doesn't replace the healthcare system, it enhances it. It works right alongside it, but without the stress or bureaucracy. And studies prove it. Fewer visits to the emergency room or doctor's office, on-demand access 24/7, better healthcare outcomes, lower healthcare cost, increased lifespan, and a lower micromort count. Your 1 in a million chance of dying. And priceless peace of mind. And here's what most people don't know. Even if you rarely use the doctor, just having direct access still gives you these associated benefits because knowing a doctor works for you, not the system, brings clarity, confidence, and calm to every healthcare moment. And in this video, I'm going to show you how it works and why it works. Once you see it, you'll never look at healthcare the same again. The maze of modern healthcare. Let's face it, healthcare today, whether it's private insurance you pay for, insurance provided by your employer, Medicare or Medicaid, it can be confusing, costly, uncertain, and honestly scary. PPO, HMO, high deductibles, in-network, out-of-network, what's included, what's not included, copay, no copay, what facility you can go to, where you can't go, ER, urgent care, appointment, or wait it out. Do you need a specialist or not? It's a maze, and you're expected to navigate it while you're stressed, worried, or in pain. And when something doesn't feel right, whether it's you, your child, or someone you love, what's the first thing you do? You turn to Dr. Google. You call a friend or a relative. You try to piece together memories or advice you once heard. And suddenly, your screen fills with the scariest possibilities imaginable. Your heart starts racing, your blood pressure goes up, and now you're even more overwhelmed than before. What should you do? Should you go to the emergency room, urgent care, schedule a doctor's appointment, or wait it out? Then more questions hit you. How much is this going to cost? Is it covered? Is your deductible met? Do you need a referral? Do you need pre-authorization? How long will you have to wait? Where do you go? Which facility is allowed? Or maybe you or your loved one already has a diagnosis and it scares you to death. Is it accurate? What does this mean for us? Is the treatment plan the best one? Do I really need this surgery? Do I really need this medication? What are the side effects? Are there safer alternatives? We've all been there, or we love someone who has. And if you haven't, unfortunately, it's just a matter of time. Because this is the reality of the healthcare system, and this is the reality of our bodies. There is something out there called concierge medicine or direct primary care. But the thing about it, most people don't have an extra $300 to $600 a month lying around to afford it on top of their regular health insurance. It was designed for the wealthy, for people who could afford to have a doctor on call day or night, with no middleman, no insurance companies, no private equity firms, just you and your physician. Back in the day, that's the way care actually was. Doctors made house calls. Families knew their doctor. There was a real relationship there. And that kind of care didn't just treat people. It had compassion for them, real trust, real continuity, real compassionate care, the kind every family deserves. And then we had a thought. What if we could bring that kind of care, the kind families used to have, the kind the wealthy people paid $300 to $600 a month for, to everyone? What if we could make it available anywhere to anyone at a price everyone could afford? What if we could use the power of technology, the strength of compassion, and a compassionate nationwide network of doctors, a simple subscription model, and the power of numbers to bring virtual direct care to every household in America without the high price tag? What if we could give everyday people the same level of access, the same peace of mind, the same direct connection to doctors the wealthy get, but for less than 50 cents a day? So we built it, and then we said, let's make it even better. Independent evidence and outcomes. First, this model has been studied by numerous independent organizations, and all have shown the same associated benefits from simply having a direct care program in place. You receive on-demand access from anywhere in the world at any time. Improve healthcare outcomes. Fewer visits to the emergency room or doctor's office. Lower micromort count, your 1 in a million chances of dying, and the peace of mind knowing you have a doctor who works directly with you, which we call medical guidance. Everybody in their right mind would want that, wouldn't they? Of course they would. The Society of Actuaries wrote, 2025, direct primary care members experience a 53% reduction in emergency room claims cost, as well as approximately 40% fewer emergency room visits in general compared to those in traditional healthcare plans. The Journal of General Internal Medicine wrote, we demonstrate that the direct primary care practice can yield upwards of $25,000 in annual cost savings over the fee-for-service practice, while also providing more personalized patient care. NIH had a study in 2024. The minimum mean healthcare expenditures avoided by utilizing telehealth modalities is $1,171 per family. 100% reported texting questions to their doctor. 93% sent pictures. 88% telephoned their physician. Valor, direct primary care, wrote, fewer emergency room visits, reduced hospital admissions, and a decline in specialist referrals are some of the broader economic benefits observed with the rise of direct primary care. Haas Medical wrote, direct primary care members with hypertension are 12% more likely to have their blood pressure controlled than Americans on commercial PPO plans. 40% fewer emergency room visits, 53% lower ER spend. SHRM, Society of Human Resource Management. Under a direct primary care model, employers can offer a more flexible and cost-effective approach with lower avoidable utilization, fewer emergency room visits, reduced hospitalizations, and better chronic care management. Now, what are real people saying? And these are experience echo the data. Fewer unnecessary visits, faster answers, lower cost, and renewed sense of control in moments that matter most. These are real Compassion MD members.
I actually found it to be spot on and excellent. We were able to meet virtually. I had my camera on. He had his camera on. I was able to tell my complete history and experience with my symptoms at present, but also that history, which you don't always get these days. Oftentimes, it feels that doctors are limited with their time, and so you have this sort of sprint conversation in contrast to a marathon where you feel like you have to give the quick version and not the full picture. And so I absolutely feel like I was not only able but encouraged to share all of the history that I had experienced, especially as related to COVID. And I would imagine with any issue I had that it would be the same.
Hi, Ron Downing here. Just started up with, ended up taking my first phone call with a doctor. It was awesome. They ended up helping me out a lot. So
How long did it take you, Ron, to do everything from start to finish?
probably less than 10 minutes.
Awesome. Thank you, sir.
All righty.
Would you recommend it to friends?
I will recommend it to friends. Hi, Ron Downing here. Just started up with, ended up taking my first phone call with a doctor. It was awesome. They ended up helping me out a lot. So
How long did it take you, Ron, to do everything from start to finish?
probably less than 10 minutes.
Awesome. Thank you, sir.
All righty.
Would you recommend it to friends?
I will recommend it to friends.
All right, thank you.
Absolutely.
We've got a whole piece behind medical guidance in it where, if you do have a provider, you've got a doctor, you've seen them, you've got whatever issue. But, as you know, I mean, sometimes treatment plans are confined by the insurance company, right? Restrictions on your location. I mean, there's different things that come up, right? And so those individuals, those patients don't know sometimes that there are other options, right? There's other treatment options or there's other things that could be done. And just, if for nothing more than just reassurance that, hey, your course of action seems 100% appropriate versus, hey, there are other choices you have too. If you want to wish to explore those, we'll give that sort of medical guidance to individuals as well. So that's another piece that we've kind of layered in, which we found a lot of folks that are part of our programs now like, because, there's, unfortunately, now when you go to with a doctor's office, your a doctor. I mean, you're kind of seeing patients fast and going through stuff. You got to get through a certain amount of people during a certain period of time. For us, it's like, okay, well, let us help reassure you and or give you some guidance into what you're doing and what's happening to you, because for a lot of folks, it's just that reassurance just helps, right? And you come down, temperature goes down, you feel a lot more comfortable saying, hey, okay, I feel good, I'm on the right course.
I love that you said that because, especially in oncology, getting that second opinion and hearing something again can really help to solidify it, because the first time all you hear, want cancer. And then when you get a chance to go and dissect it, exactly, Ricky, you go to another doctor and they say some of the same things and some of the same words and some of the same plan. It makes you feel, one, comfortable with the first doctor you saw that might be closer to your house, that might be able to provide care, closer to where you live. But it also helps to just reinforce, what the plan is, what the diagnosis is. Hearing it again, you can take an advocate with you. So that sort of second opinion consult is something that I think many breast cancer patients would love, because sometimes you got to travel really far to get to that next opinion.
Right, exactly. That's kind of our thought behind a lot of it has just been that. As I think obviously mentioned this. I mean, there's tons of places, there's tons of great doctors across the United States of America, and there's tons of places that don't have access or it's too far to travel. You got to take time off for work, travel, stay in a hotel, et cetera, and a lot of this can be done remotely.
That was Dr. John Karangi and Dr. Monique Gary. Now it's here, Dr. Evelyn Lewis.
I think it's, one of the great things, again, as people talk about the best thing since sliced bread, because the need for someone to be looking over and being readily available and able to provide some help is indeed what many people need these days. Because it's become a more complex system to navigate, both for the doctor as well as for the patient. And so having a tool like that is very much needed this day and time.
We have a mission that can help a lot of people. We're here to enhance the healthcare system, not replace it, not fight against it, but to work right alongside it, providing direct care, virtual direct care, that is proven, studied, and validated. And that's why I'm sharing this with you today, because once we saw the results, once we understood the need, once we saw how universal the desire was, we knew we had to bring this to the everyday person, not just the big companies, not just the wealthy. Now imagine your life with this kind of access. Imagine having a doctor available anytime, day or night, whether you're at home, at work, or on vacation in the Bahamas. Imagine having a doctor in the middle of the night when your child spikes a fever, starts coughing, or something just doesn't feel right. And instead of panicking, you simply tap a button or make a phone call and talk to a professional who knows what to do. Imagine having a licensed physician ready to help you when you receive a diagnosis or you want a second opinion before making a major medical decision. Imagine having a doctor to talk to when your mother or your father or someone you love is dealing with a medical issue. Someone who can guide you, calm you, explain the situation, and help you make the right decision. Imagine having a doctor when you just need a quick refill, even if you're in another city, another state, or traveling across the country. Imagine having a doctor who actually listens, who takes the time to explain everything clearly, who doesn't rush you, who works directly for you, not the system. No middlemen, no insurance red tape, no surprise fees. Imagine having access to mental health hotline when you're feeling anxious, overwhelmed, stressed, or when someone you love is going through a mental struggle and you knowing you're not alone. Imagine saving $100, $500, even $1,000 a year on dental care, vision care, and prescription medications simply because you have access to discounts powered by nationwide networks. Imagine having a doctor who can review your medical records and provide a documented second opinion when needed, giving you clarity, confidence, and peace of mind at some of the most important moments of your life. This is what your healthcare should look like. This is what direct care makes possible. And this is what Compassion MD gives you every single day. Here's what you get the moment you join. Your own HIPAA-compliant patient portal, a private secure medical portal where you can schedule appointments on your time, view future and past appointments, see your medical records, upload documents and files, access dependent files and add dependents, have secure video consults, message providers directly, see provider notes and past provider notes, manage everything for you and your family all in one place. This is your personal, secure health hub. On-demand access to licensed medical doctors and providers. You get direct, immediate access to urgent care, free consult fee right now, and that's a bonus for a limited time. Primary care, free consult fees right now. That's another bonus for a limited time. Medical guidance, just a $39 consult fee when you use it. Mental health hotline, just a $69 consult when you use it. Doctor oversight, that's included with our Patient Safety and Fair Care Council. Care coordinators, we have rave reviews about our care coordination team. They provide that compassionate care, the human support team. So if you don't want to go onto the app and schedule and you just want to pick up the phone and call, they are on 24/7, ready to provide compassionate medical guidance and care coordination to you anytime, and much more. You're never alone. No middleman, no long waits, just real doctors, real help, in real time. The proven benefits of direct care. This is what you also get. This is where the value becomes unmatched. With direct care, studies show you get on-demand access to doctors 24/7, anytime, anywhere, fewer visits to the emergency room doctor's office, improved healthcare outcomes, lower overall healthcare cost, increased lifespan, you live longer, a lower micromort count, you're 1 in a million chance of dying, direct access to your own doctor without the middleman, a real relationship with the same doctor. It's known as continuity of care. Or you choose and select a new doctor until you find the one you love. The ability to talk to a doctor about your loved ones through medical guidance. Documented second opinions, or a quick virtual medical guidance. There's some bonuses automatically included We didn't just build a direct care program. We added bonuses most families are paying for separately. Dental and vision discounts powered by Aetna's network. Prescription discounts. Patient Safety and Fair Care Council. Guide our doctor network. And you have access to them. Continuity of care support. You can see in the same doctor. You have your 24/7 care coordinators. On-demand access. If you just want to pick up the phone and talk to somebody, they're there. These are all included automatically. Enroll now, and unlike direct care, get the access to direct care now. Scroll down right below, click the button, and instantly gain the access to licensed doctors and all the associated benefits of direct care. And remember, for a limited time only, you're getting free urgent care consults. That's normally $29 per consult and valued at $99 per consult, now free for a short window. And that's not just for urgent care, that's also for primary care consults. This bonus will disappear without notice. Scroll down below, fill out the form, and subscribe now. Warning, the free urgent care and primary care consults, that bonus won't last long. Act fast before the window closes. Here's everything you get when you join. Your own HIPAA-compliant patient portal, schedule visits, past and future appointments, access resters, upload files, manage dependents, message providers, and have a secure video consult all in one place. On-demand access to licensed medical doctors, urgent care, primary care, medical guidance, mental health support, specialist referrals, and full physician oversights with the Patient Safety and Fair Care Council. Mental health hotline access. Talk to licensed professionals when you're anxious, overwhelmed, stressed, or dealing with emotional concerns. Specialist referrals and guidance. Connect with the right specialty with guidance from your care team when available. Dental and vision discounts. Powered by Aetna. Lower the cost of cleanings, exams, glasses, contacts, and more. Prescription discounts. Instant savings. The Patient Safety and Fair Care Council. A guidance team that helps protect you from unnecessary procedures, overbilling, misdiagnosis fears, and medical uncertainty. 24/7 care coordinator access, real human support whenever you need it. Continuity of care. Build a relationship with the same doctor or choose a new one until you find the perfect fit. Documented second opinions. Full written case reviews when you need clarity the most. Or maybe you want to go out of network and you need that documented second opinion to do so. Medical guidance for loved ones. Talk to a doctor about your family's concerns, conditions, diagnosis, or treatment plans. Peace of mind, which is priceless, knowing a doctor works directly for you, not the system. And right now you're getting it for $9.99 per month for individuals and $29.99 per month for households of 3 or more. Plus, the free urgent care consults and primary consults for a limited time. Normally that's a $29 per consult and is valued at around $99 per visit. Now free to you if you take action now. Scroll down, click the button to subscribe. This limited time bonus will end, and once it's gone, it's gone. Welcome to the Compassion MD family. To your health.